Hi, good morning, Mr. Scott. My name is Anthony, and I'm a respiratory care student from the respiratory care department. The doctor ordered you to have you being put in an oxygen. So, first and foremost, would you mind if I will check on your patient ID band to ensure correct identification, and I will also check up your vital signs. So, I already did the checking of the ID band and already assessed the patient. And then first also I have to ensure that the patient is in a safety state and make sure that they are comfortable. And then before that I already have to wash my hands with a hand-based sanitizer, or you can also just wash your hands thoroughly when going inside the patient's room. So what I am bringing here is a oxygen tank. So you will notice it with its label, with the color also, the green, and also you'll notice a sticker being put up with the label of oxygen. So I will explain it to you about the safety measures of the oxygen. So please prevent your relatives or even friends and children who will also attempt to touch this tank, because it might accidentally tip off, and then we just have to prevent from any accidents. And then I already put up a signage outside in the door with a label "No Smoking" sign, because this oxygen is non-flammable, but if exposed to any source of heat, source of light, or even some combustion, it would lead to burst or even worse, to fire. And then another thing is that when we will not use this one, we will also put it on a cap to ensure that the oxygen is not exposed, and also to also prevent from any accidents. And then by the way, the doctor ordered you with a flow of 2 liters. So I have here a device, so I just have to put it first on the side. And then first is I have here a regulator, which is a pin index safety system. So when checking this one up, I have to check the O washer or the nylon washer if it is still in good condition, to ensure that the system is still leak free. And also I have to check the pins and the whole device. And then first is I have to crack first the cylinder. It might be too noisy, but it will just take up like millisecond only. So I already cracked the cylinder, and then once I'm done, I'm going to insert this one. Make sure that it is properly tightened. Inserted it properly, and then tighten it up. And then turn on the cylinder, and then we will notice the gauge to go up. So the flow is the pressure is at about 1100. And then because the doctor ordered you a flow of 2 liters, we're going to set this one up to 2 liters. So we will notice there's air coming out. And then this one is one of the device that we will be putting up. So it is a nasal cannula. So when putting this one up, it should be removed from its safety container or plastic bag. Insert it. And then when putting this one first, we have to also check if there's air coming out from the nasal prong. And then first is when putting this one up to the patient, we have to loosen the connections, and then put this on the side, on the earlobes, and then carefully insert the nasal prongs to the patient's nose. So by the way, Mr. Scott, because you're given nasal cannula, I will prohibit you from putting up oils or such as Vaseline, because it is also prohibited, especially you're being put up with an oxygen. So I have also will ask the patient, by the way, if they are comfortable with it, with the device, if it is not too tight, and then if so, I have to adjust. And because the patient is doing fine, and then he already wants to remove it, and the doctor wants to remove it, we have to remove the device. Make sure you have to remove this one up, turn the flow back to 0, and then the device should be put up back to its safety container. Put it in the plastic, and then put it on the side to maintain its sterility. And then when checking this one up, by the way, sir, is because I mentioned it to you, the flow or the pressure was 1100, And then to know if how long the duration is, we have to compute it times 0.28, which is the factor of the E cylinder, and divide it by with the flow, which was 2. So that way we will know how long the auto tank would last. And then when done, we have to turn this